Hello everyone, I am Samanvitha Praveen from Group 182A and I am here to present about the topic that is water salt metabolism and renal disorders. Peculiarities of biochemical processes in kidney. Kidney have a very high level of metabolic process. They use about 10% of all the oxygen which used in the organism. A lot of ATP formed in result. Kidney have a plenty of different enzymes. Specific for kidney is alanine, 3 form isoforms. Now coming to reabsorption, length of the renal tubule is about 100 kilometers. So all the important for our organism are reabsorbed during the pass through these tubules. Epithelium of the renal tubules reabsorb per day, that is 179 liters of water, 1 kg of NaCl, 500 grams of NaHCO3, 250 grams of glucose, 100 grams of free amino acids. All the substances can divide into three groups, that is actively reabsorbed substances, substances which are reabsorbed in a little amount, non-reabsorbed substances. To the first group belong, that is the sodium, calcium, chloride, magnesium, H2O, glucose and other monosaccharides, amino acids, inorganic phosphates, hydrocarbons and low weight proteins. Now, coming to the role of kidney in water balance regulation, excessive entrance of water leads to dilation of the extracellular fluid, decrease of the osmolarity, inhibit the secretion of antidiuretic hormone. Walls of the collecting tubules stay non-penetrating to water and dilute urine formed. If volume of the blood circulation increases, circulation in the kidney decreases also and hypoosmotic medium of the kidney medulla removed. Some substances in these conditions return into the blood. So, excessive of water carried with the urine and a lot of soluble substances are reabsorbed into the blood. After water loading stopped, hypoosmolarity in the kidney medulla returns for the previous stage during some days. Now, this slide shows the importance of some of the hormones and their functions. Now, coming to the water balance, water intake. Water is supplied into the body by exogenous and endogenous sources. Exogenous water intake is highly valuable, which may range from 0.5 to 5 liter. Ingestion of water is mainly controlled by a thirst center located in the hypothalamus. Water output. Water losses from the body are variable. There are four distinct routes for the elimination of water from the body, that is urine, skin, lungs and feces. Presenting features of the renal diseases, that is dysuria, uritis, inflammation of the urethra and inflammation of the vagina and the penis, where the polyuria and the urethruria, where increased urine flow at the night, and solute and the diabetes insipidus. Now, there is decreased urine output, hypotension, hypovolemia, and intrinsic renal disorders and diseases. Urine tract. Now, coming to the renal pain, dull constant pain in the leon, renal obstruction, acute and acute nephritic syndrome. Now, coming to kidney renal failure. Risk factors, that is the chronic disease, inflammatory diseases, blockage of urine collecting system, chronic infections, rare genetic disorders. Treatment of kidney failure, that is dialysis, transplant, best means for the treatment, whereas dialysis is hemodialysis or peritoneal dialysis. Hemodialysis, a process by which the excess waste products and water are removed from the blood, requires an access to the patient's blood stream and the use of